Hi, welcome back if you've been following along. My name is John, and I just went through lumbar fusion of L3, L4, L5, and S1 um, 9 days ago. I think it's 9 days. Um, I've been home for um, just about a week now, I guess. Well, no, not quite. Anyway, I've been home for about 6 days. Um, it's 11 o'clock in the morning. I had a nurse came by to give an eval to see if I need follow-on help, mainly training on how to get up and around and get dressed and protect me from myself is how I see it. Um, I guess I said all the right words. She thinks that I don't need that kind of training or help anymore, and so I've been signed off from that. At some point, I'll probably have physical therapy come in again, and I think it'll probably be after the 2 week mark after I do the post op follow up, which is supposed to be about 2 weeks. I think July 5th is it. In any case, here we are today. I'm working to cut down my meds. I've been normally taking like 2 Percocet and a muscle relaxer every 6 hours. And there are different ways I can modify that. I can either stretch that 6 hours out, or I can start taking one um, at the prescribed time rather than two, and then maybe take that second one somewhere in between. So right now I'm going off my idea is to take the two pain pills as need, or take 2 pain pills and a muscle relaxer in the morning once I wake up, and then 6 hours from that, cut it back to one pain pill and a muscle relaxer, and then when I go to bed, go back to the two and a muscle relaxer to help me sleep through the night. And I think that's going to be doable. Anyway, we'll try that. And the main reason I think is I want to be cognizant of where I am and what my pain levels are as the healing goes on. And it's really sore today. So we'll see how this goes. I mean, I took my pain meds, I guess, about 2 hours ago. My pain level, just sitting here, is about a 3, and if I get up and walk, it's going to be close to a 6 or a 7. But it's in one spot. So, day before yesterday, I was sitting at the table working on the computer. Just a change from being either in bed or in this recliner, which is amazing. And didn't have my back braced against anything. I was sitting up straight. I have pretty good posture, and I coughed, pretty hard, and I felt something pop. And I didn't think I messed up the hardware. I thought I may have done something to an internal or external suture, staple or suture. But that pain was significant, and it's kind of still there. And it's point tenderness, so I know where that is. I called the doctor's office and told them what I did, and they said, it's quite possible that I tore muscle or I tore internal suture or something like that, but the chances of me disrupting the hardware are very slim. And that was good enough for me. I mean, if I've got torn muscle or torn staple, or that's fine. I mean, it's not fine, but that's doable. My main thing is the hardware, because I've in the past, when I've had shoulder surgeries, I've broken the hardware. So I just wanted to be sure that I have a relatively confident that I didn't screw it up yet. So anyway, so my idea with the pain meds is my next concern is I'm going to get to the point where the pain is not significant. It's already less significant as before surgery. So generally let pain be your guide. I'm wondering if when I don't have as much pain, if I'm not going to have that guide to prevent me from lifting, twisting, bending. That's really what's my concern is for the duration. Working out for the next couple of months is I'll start feeling better, but the healing is not going to catch up, and that I'll injure myself because I'm feeling fine. So I think the longer I have some pain, it's going to be a mental note that, hey, I can't twist, I can't bend, and I can't lift, even if I feel okay. And that's really going to be the struggle. So the nurse came today, and I asked her about me wearing a back brace. And a lot of times there's arguments on both sides about wearing a back brace. One, it'll help you maintain that posture, the rigidity, and in my case, it will remind me not to do the bending, lifting, twisting. The other side of the argument is it'll make your muscles lazy, and it will inhibit the healing because it won't allow your core to get back to where it was. I'm in pretty good shape, so I'm not too concerned with the core. I need a physical reminder to stop me from bending, lifting, twisting. And so I'm going to start wearing this brace whenever I'm up and about. And I just think that's the way I need to do this. So that's where we are. Like I said, I think it's 9 days post-surgery, I believe. Feel pretty good. Pain's not too bad. I say that, of course, I just took pain meds two hours ago. It's significant, but it's not as bad as I expected. It's not as bad as the shoulder surgeries were. And I think that's pretty much what the updates are going to be going forward. I'm hoping I'll be filming, I guess, when I am out and about and doing whatever I can do outside of being in this chair, to hopefully that'll help me to remain diligent about my posture, no lifting, bending, twisting, because I'm filming now. I got to be accountable. So I think I'm going to use this tool of making videos as reason enough to be diligent in my physical restrictions, so if that makes sense. Anyway, it's a beautiful day out. The water was flat this morning. It would have been a great day just to throw a rod out and go fishing. And that's going to be the issue, right? How do I do that? I don't. And we'll figure it out. You know, there's other things to keep my mind and body busy. And that's where we're going to go from there. I've posted a lot of videos lately. A lot of them like this are very short, and that's probably how it's going to be, very short. Please like and subscribe. There's going to be more to this journey other than me sitting on a couch. But I'm hoping this helps anyone that's getting ready to undergo this surgery. Like I said, it's pretty intense surgery. I haven't seen any others that have had this many levels of fusion. You know, and so far, from what I've seen from the nurses and the physical therapists, they say I'm doing great. So I'll take that blessing. You know, I just pray that this is helpful to anyone going forward, and you know, work smart, not hard. And that's got to be a new trend to move forward. Thanks so much for staying in touch. Thanks a lot for staying. I really appreciate the those that have been following this journey, and look forward to more active days. Thanks a lot. Take care. God bless.